Hi, today I'm going to be simulating a central line catheter insertion. Before beginning, I will review my patient's chart to make sure I look at their INR and platelet counts to ensure that there are no contraindications for this procedure. I will also look at their allergies and confirm that their consents are signed and in the chart. When walking in the room and assessing the patient, I will make sure that my EKG and pulse ox alarms are on and audible. Before beginning, I will wash my hands and use my ultrasound probe to identify my landmarks and targets. I will look to see that my artery is non-compressible but pulsatile, and that my vein is compressible and non-pulsatile. Now I'm going to put on my mask and hairnet. I'm going to clean the patient's neck with chlorhexidine and let that sit for 3 minutes. While that sits, I will place the patient in 10 to 15 degrees Trendelenburg and turn her head to the left. And don my sterile gloves. Now we'll apply the sterile drape to the patient. I will have an assistant prepare the ultrasound probe sterilely. I'm going to assemble the rest of my central line kit. I'm going to prepare the guide wire to make sure it is ready for insertion into the needle. And I will also flush all of the lumens of the catheter except the distal one. Now, with my sterile ultrasound probe, I'm going to reconfirm the internal jugular vein. Okay, and once I have done that, I will use my needle, aiming it at the ipsilateral nipple, keeping the IJ at the center of the ultrasound machine. While using negative aspiration, maintaining negative aspiration, I'm going to confirm that I'm in the vein and I have venous blood return. Once confirmed, I will drop my ultrasound probe and remove my syringe. Now I'm going to advance my guide wire into the needle 10 to 15 centimeters, listening to my EKG alarm for notable ectopy. I'm also noting if there is any resistance while I'm advancing. Now I can place the ultrasound probe in the longitudinal view while holding the guide wire at all times to verify placement. I'm going to remove the needle while holding on to the guide wire. Now I'm going to use the scalpel to make a small incision to prepare for the dilator. While holding on to the guide wire, I will thread the dilator onto it. And I'll insert the dilator about 2 to 3 centimeters and ensure there's no kinking of the wire, and then remove it, holding on to the guide wire still. I will now insert the catheter over the guide wire. And I will use a push-pull technique to advance the catheter over the guide wire. Once the guide wire is visibly out of the distal port, I will take control of the guide wire from there and advance the guide wire there. I'm withdrawing the guide wire from the catheter. Once that is in, I will check with my syringe. I am checking that all ports have blood return and that I can flush them without resistance with sterile saline. Now I am able, once I am happy with the position of the guide wire and all of the ports, I can suture the guide wire, or suture the catheter in and apply a sterile dressing. Once that is finished, I will ensure that there is a chest x-ray in order for a chest x-ray post-op, and I will document this all in the chart.